Exactly. Exactly.
So anyone 55 and above should think about having taking the vaccine unless they have some kind of allergy that would avoid them. But then they would know unless they contact their doctor. So I think it's important that if you do have any allergies, then you should have a talk with your healthcare provider. Mr. Candido, you also took the vaccine. Now, I want you to first tell us in English your experience, and then you can go on to tell us about it in Spanish so that the Spanish community understands what the process was. So, you took the vaccine today. What was the process? How did you feel? Was there any side effects? What happened when you got the vaccine?
Good night to everybody. The news coming like this, I received the information that they got to start to do the vaccine to some people. I immediately received the information. I agree to do it because first time is the vaccine coming to cure for the coronavirus. And then I'm a person, couple days I go to get CTE out, and then I look for protection.
Right.
And today I went to the with the group to take the vaccine, and no, it's like the people speaking.
Right.
Because I took the vaccine, I passed my time that I had to be waiting for any reaction, and my body continued in the same way. I mean, I feel good, and I'm still feeling good, and for me, it's very, very good that everybody receive it. And if everybody receive it, and then in one moment, we got to be clear for the coronavirus. And the coronavirus disappear from this island, got to be something important.
Right.
Nobody got to die. No, the economy got to change in the island immediately.
Yeah.
And then that's what we're looking for. And then if that change it, I mean, nobody with coronavirus, and then we can be free. Because right now we have free to be in the road up and down without the vaccine. Right now, I got to feel more better than before. Because I received it today.
Yes.
you.
Okay, so now can you explain that to your Spanish community in Spanish?
Yo le puedo decir a la comunidad dominicana que hoy fui un ejemplo de recibir la vacuna del coronavirus. Soy el ejemplo para ustedes, para que mañana ustedes también puedan recibir su vacuna y así la isla esté libre del coronavirus. Ahora mismo tenemos el miedo por el coronavirus. Entonces, después que todos tengamos la vacuna, es decir, que ya vamos a estar libres del coronavirus.
Okay, thank you. So now, Mr. Alcius, tell us what your experience was.
First of all, Mrs. Robinson, thank you for inviting me in your show tonight, my first time.
Okay.
I am so
Welcome.
grateful. And, well, you know, it was for me a very good experience to participate in that exercise. Actually, I am a psychologist. I have been exposed to this kind of experience before, and then even though most of my experiences were placebo, but this time, this is the real vaccine. It is not a placebo.
Right.
And so I wanted to do that because I have heard growing rumors concerning the effectiveness and the safety of the vaccine. And so I have heard also people who are in observation. They want to know who's going to be the first person taking the vaccine. Certain people call that person brave. To me, it is not about bravery in that manner, but it is just a matter of knowing exactly what is it, be educated about it, and then be willing to participate. It is like to give your contributions to your country. It is a national matter. I believe everyone, even though it is not an obligation, but we have a duty, a moral duty to participate. And so I decided to take my shot. And so far,
Okay.
it is the best vaccination shot ever for myself.
For yourself,
Yes, so far.
So far. I know, right?
Yes.
So it's also when you say having a duty to protect yourself and your country, because if you protect yourself, you're also at the same time protecting others, right?
Exactly. So I don't call it obligation for certain reason. I don't call it obligation since it is not mandated.
Right.
But for me, it is an obligation to do it.
Right.
Because I know when I do so, I protect myself, I protect my family, and also I am a man of faith.
Right.
So I protect my congregation, and I protect everybody. And this is where we can have herd immunity
Exactly.
in this in this country. I think everybody should encourage herd immunity.
All right.
Yes.
So now can you say that in Creole? Yes, let's address the Creole
The
population.
Creole population. Sak passe. Do you know some word in Creole? You know sak passe.
Naboule.
Okay, now we. Okay, so I have someone with me now. Okay, well, pour tout le monde qui parle créole, bon, moi c'est Alcis Dor, moi c'est psychologue et aussi moi c'est homme de foi. Donc moi c'est pasteur et moi content pour me capable dans show à soya pour nous capable parler un peu de vaccine pour contre COVID-19 là. Et d'ailleurs dans vidéo que moi t'ai mettez dehors dans ce maintenant, c'était une vidéo qui était fait partie de sensibilisation que le gouvernement Turks and Caicos a fait pour être capable de faire moun comprendre l'importance en vaccin pour COVID-19 là. Et alors aujourd'hui, en fait, moi j'étais pour une première dose là. Et jusqu'à présent, moi senti bien, pas gagné effet secondaire jusqu'à présent, moi senti. Donc, n'a suivre dans le jour qui a venir toujours, mais nous espérons tout bagaille pour aller bien. Donc, nous, dans la radio, justement, pour nous capables de faire connaître comment ça t'est passé. Et moi, connais tout, il y a un monde qui t'a aimé prendre vaccin, mais à cause de, un pile rumeur qui t'est circulé, et pendant des temps, donc, concernant si vaccin est effectif, et puis si pas gagné un pile danger là-dedans, gros danger là-dedans, eh bien, pour information que nous gagnons, puisque là, nous t'es prendre vaccin, il y a nos papiers qui gagnent toute information qui est importante concernant COVID-19 là. Donc, nous voyons que oui, il y a un effet secondaire qui est capable de faire. C'est pas tout le monde qui subit effet secondaire là, mais il dépend de type de corps qu'on gagne. Conditions santé autour capable de gagner effet secondaire. Donc mais ça pas veut dire que si tu vas gagner effet secondaire que vaccin jusqu'à présent il pas travail. Donc nous connaissons les nouveaux c'est un essai Donc, nous ap fait ça, nous espérer, et au fil du temps, ap gen plus information qui bay moun ap konnen plus, mais c'est que pour moun qui te gen doute à savoir, est-ce que doit prendre, qui moun qui prend le point en premier, eh bien, m'te fait partie du premier groupe qui te prend vaccin jodi. Donc, avec ça, me pense que, et m'a dit nous très bien, pas gagner obligation jusqu'à présent. Pas gagner obligation, donc, yon moun pas obligé, faut que ou prenne selon sa gouvernement dit. M'pas parler pour gouvernement, mais selon information que moi-même, moi été recevoir, parce que c'est même information pour tout le monde, donc pas gain obligation. Cependant, yo encouragé moun capable prendre vaccin, puisque là on prend vaccin, ou est des têtes pas, ou est des communautés à tout. Merci en ville.
Okay, great. Thank you. Now we move to Mr. Bill Clare. Tell us your experience and what happened when you took the vaccine. Did your face start to move all about, and there's some videos going around with some strange things. Explain to us how confident you were in taking it, why you took it, and what next?
Okay, thank you very much, Ms. Robinson, for inviting me to be on your program, which I think is very important, in particular at this time. On Friday, I visited my local doctor, Dr. Malcolm, and he mentioned to me that the vaccine is in the islands, and on Monday, the governor and the premier and other members of the government would be taking the vaccine, and he wanted to know if I was interested. Well, I would take it. Of course, I decided I would. I'm 75 years of age. I've been watching, and I think most of us in the islands who watch television have seen what is happening in America, how many people are dying every day. I went in very positive, and when my turn came, the nurse just gave me a little stick, and a few seconds the vaccine was in my arm. I felt no difference. I didn't feel anything. And when it was over, we went out and sat in the section for 15 minutes for observation. They gave me a sheet of paper with information on it regarding the vaccine. I know a lot of rumors have gone around and are still going around, but our people should be very sensible. I mean, they see what's happening in the world today. And when you lose your health, you lose everything.
That's right.
You can't replace it.
Exactly.
And so I want to encourage every citizen of this country, and not only the citizens, all of us who live here. There are people from over 120 countries living in this little island. Mm-hmm. And so we need to do the right thing. And my appeal is to all of you, whether you're my age or under, please take time out and get the vaccine. The life you save, as I say, may be your own.
Right. So you say you're 75, but we say people old now. I mean, well, not nowadays. This has been for a while. Maybe we need to change it. But we classify from 55 up. So we are actually talking to persons from 55 years and older, as elderly and who should take the vaccine. We also have the class of persons who have underlying conditions, hypertensive, kidney failure, cancer. Whose immune system is,
Yes, the nurse called me earlier on today to tell me that I was due to take the vaccine at 3 o'clock, and she asked me a number of questions, and including the one you just asked, and I told her the only problem I have is allergies I have is if I go around flowers or trees, in an instant I get a rash. But okay. I use hydrocortisone, and it's gone, nothing else. And I told her the different tablets that I take every day. So that was it.
Right. So there are some persons who have allergies, depending on how severe it is, then they won't be able to take it. But then they won't know unless they have that conversation with their healthcare provider. So you think that the vaccine is overall a good move, a good stand for the Turks and Caicos in order for us to, like, I think it was Candido. Did you say herd immunity? Oh, okay. Okay, Alcia said herd immunity. For us to move forward so that, we can get as close to back to normal as possible. I mean, I don't think we will get back to normal. What do you think the steps are that persons within the community need to take for us to move forward and be able to reach that point where we gain herd immunity?
Well, I think we all would agree that our lives have been changed forever. Mm-hmm. And I doubt very much whether life will be the same as it was before the virus. We need not to let our guard down. Right. We have to realize that tourism is our main industry and will be so for a very long time to come. Mm-hmm. And we have people, as I said earlier on, when I used to do my talk show at that time, there was over 120 nationalities living here.
And probably more now.
Have to be more, okay? And so you have people coming from all over the world. We have to take the necessary precautions. We cannot let our guard down. We have to continue to wear our masks, to wash our hands, to keep social distances. And young people need to realize, that this party and this getting together, I'm appalled by the things I see sometimes on weekend with young men. Mm-hmm. This has to stop. You have to realize that life is precious. Mm-hmm. And you only live once. So I want us to take this very serious. As we watch the news every day, we see what is happening in our world. They say when America sneezes, the Caribbean catches cold.
Yeah.
That's a slogan, okay?
Yes.
But it is, in essence, it's true when you think about it. Mm-hmm. So I'm talking to everyone who lives here. I don't mind where you come from. You're here. You're part of us. And we're all going through it together.
Yep, we all going through it together.
Take this thing serious. Go, please, for heaven's sake. Take the vaccine.
Mm-hmm. So, Mr. Candido, what is your message? What do you think, and how do you think we're going to get there? Herd immunity, ensuring that our population is safe, with all those persons who can take the vaccine, taking the vaccine, and creating that herd immunity. How do we get there? What can the Dominican and Spanish, because we have other persons other than Dominicans speaking Spanish, what can the Spanish community do to help us get there?
The first thing, I can say is first that had to come from us first to say, let me try to be to follow the instruction. Plus the vaccine, trying to any situation to avoid that not go by your body. I mean, if we do the procedure that the authority trying to do,
the health protocols, yes.
Yeah, plus that we took the vaccine. That means we had all the protection for us and the family too. Because the thing is simple. I can be doing a lot of things in the room. I go by my house. I have my grandchildren. I have my children. I have my wife. All of my family can be infected.
Right.
I mean, if everybody in the house follow the instruction, plus take the vaccine, and then after that, the thing go to change it. I mean, and in one moment we can be free from the coronavirus. That's for my reason that I went immediately to be a sample. A sample plus my protection from the coronavirus. because I know that's affecting and killing the person. You know, I don't want to be one of that person.
Right. So you're leading by example.
Yeah.
Yes. So now, yet again, I'm going to ask you to do that in Spanish.
Okay. Yo le digo a toda la comunidad dominicana que por favor usen la vacuna. La vacuna te va a proteger a ti y a tu familia. Recuerden bien que tú lo puedes llevar a tu casa. Ahí están tus niños, tus hijos, tu nieto, tu bisnieto, incluido. Y tú lo enfermas. Si tú aceptas la vacuna y hace que tu familia, todos reciban la vacuna, estarán libres de la enfermedad del COVID-19. Es importante que tú también le digas a los demás que acepten la vacuna para que ninguno de nosotros pueda fallecer por el descuido de no tener los protocolos y de no dejar ponerse la vacuna, por muchos rumores que tienen en las calles. Yo hoy me puse mi vacuna y me siento normal como ayer, como antes de ayer y como todos los días. Es decir que toda que haya que ponérmela me la voy a poner.
So you've had no reaction, no face twisting, no strange things happening, nothing of the sort.
Muchas personas dicen de que después de la vacuna van a tener mucha reacción. No tengo ninguna. Many people see after the vaccine, you go to get a lot of reaction, that your body got to be moving in different side, but nothing happened with me. And I know nobody from the group, nothing happened. We wait for the 15 minutes that we have to be waiting, and nothing happened. I not feel in my arm when they did the vaccine, and I feel okay.
Yeah, okay. All right. So, Mr. Alcides. Now, yes. I don't have to repeat that again. You know what time it is. So
I know.
Go right into it. Tell us about it.
Yes. One thing I noticed, Turks and Caicos Islands is a blessed country. We are so blessed. However, we need to be sincere to ourselves that we are no different from the rest of the world. So, one thing we study in psychology is cause and effect. And we know that the same causes produce the same effects. We have followed protocols for over almost a year now. I am not against protocol that we still need to follow. But if we look back from March last year, we have followed protocols, social distancing, washing hands. We have done all these. But we still cannot return to normal. Even not normal, but we're still far from normal. So now we have the vaccine. So I believe while we continue to follow all the established protocols, we need to gear ourselves now toward the vaccine, because it is going to be another try. Let's try something else. So far, the COVID-19 vaccine could be one of the best measures to help people around the world, including Turks and Caicos Islands. So I encourage people to take the vaccine. And I understand there are several factors that may hinder people to take the vaccine.
Right.
For instance, if we look at religious beliefs, it is one of the factors. And ethnic, it's another one.
Okay.
It's another one. Because remember, and these are part of the rumors. Vaccine has been made to destroy such a group or a particular ethnic
group.
Group.
Let's call it, man.
So it is like humanity stands against itself.
Yeah.
We are one people as the human race. We understand, we know there may be some bad guys in our midst. When I say in our midst, in the world.
Yeah.
But it doesn't mean that under the watch of everyone and a certain group of people will go say, well, let me make a vaccine to destroy a particular ethnic group. I don't believe that. I don't believe that. So, for me, it is a matter of education. And I appreciate the work that your department is doing, educating people. However, maybe if we can dig a little deeper, it will be significant.
And digging deeper is what you can talk about. How do we dig deeper? How do we get there?
Information is key.
Information
is key. For instance, the Creole community, you know, we are English. Okay, perhaps certain information they don't really have and the way it's supposed to be. Because, you know, information is very sensitive. And because of this pandemic now, and with social media, everybody wants to give information.
Even when it's false.
False
mostly when it's false.
Exactly.
Yeah.
Sometimes too, it could be out of ignorance.
Yeah.
Somebody who maybe doesn't know about the process, about the issue, but he or she may want to inform people. She or he wants to help. That way, he or she may be right or wrong. The intention was not wrong. The intention is good, but for lack of information, correct information, then it may cause harm to the community.
Right.
So that way, when people who know do the job, it is safer.
Okay.
So I will encourage your department to enlarge your campaign to the various communities in the Turks and Caicos Islands. The Dominican community, the Asian community, and every community in the Turks and yes, exactly. Yeah. Especially those whose their language is not English.
Right.
So I think you will have help from these communities, and then we can spread the information, correct information to the people. I think that way they will know this is the best way to go. They need to be educated on the matter. Yes.
Now, you see how you say all of that? Wow. You think you could remember to say all of that in Creole?
My Creole is good.
Okay.
Yes. Well, ça nous expliquait, mesdames et messieurs, Eh bien, c'est que nous connaissons pendant presque un an, nous avons suivi le protocole. Distance sociale, mettez masque, nous faisons tout bagage ça, nous suivons. Mais c'est comme si nous toujours exposés à même problème non, pas rien qui retourne dans normal, au contraire, et nous ouais bagay yo gen le tavine et pire parce que gen qu'est-ce qui a monté chaque jour, COVID-19 a monté chaque jour. Maintenant, nous venons parler de ça que nous relais en psychologie, cause et effet. Donc, nous dit souvent, même cause yo a produit même résultat. Et alors, si que nous toujours suivre même protocole yo, mais c'est toujours même résultat, n'a toujours gagné, n'a toujours mis masse. Mais si qu'on y a vin gagner vaccin. Maintenant, si vraiment gouvernement li éduquer nous pour nous connaître procédure là comment lié, qui risque qui gagne et puis qui risque qui pas gagner tout, si nous gouvernement qui a fait nous à l'aise pour le faire nous comprendre que et pas gagner trop problème pour nous prendre vaccin, eh bien me pense que nous ta plus à l'aise maintenant si gouvernement capable de faire ça, nous demander éducation. Nous demander éducation dans le sens que pour toute communauté qui a vécu dans Turks and Caicos Islands, quelle que soit la communauté, mais spécialement, je parle créole, à tout le monde qui parle créole, je pense que nous avons besoin plus d'éducation par rapport à vaccin pour nous connaître qui s'allie, côté le sorti, qui s'allie là-dedans, qui a avantage pour nous capables de prendre vaccin. Nous pensons que c'est rôle gouvernement. Alors, et Madame Robinson, dans le département par là, c'est ça que on fait sensibilisation. Mais il y a une différence entre sensibilisation avec éducation. Alors, nous sensibiliser un pile monde pour prendre vaccin, mais éducation c'est un l'autre bagaille pour montrer monde qui ça qui vaccin, comment pour y prendre et pour monde qui déterminer tout si pour y prendre, si ou pas prendre. Seul bagaille n'a répété jusqu'ici selon ça et nous apprendre de toutes sources yo fait comprendre que pas gain obligation aucune pour yon monde capable prendre vaccin. Cependant, avantage li bay sou prendre vaccin, gain yon bagay en anglais ou il ça herd immunity, ça lui-même c'est que qui ça lié. C'est lorsque nan gain pandémie dans un pays, donc plus gain plus moun qui prend qui gagne immunité contre virus ça, donc il vient protéger plus moun. C'est-à-dire tout en gagne plus moun qui prend vaccin, reste moun yo absenti au pied à l'aise parce que il y a effet psychologique là-dedans. Le fait que vous connaissez ou vacciné, maintenant quoique pas gain rien qui dit que même l'on fin vacciné pas gain risque et ça passe dans tout l'autre vaccin toujours gain ça parce que la science yo pas metté yon bagay à 100%, souvent yo ka ba ou 90%, 95%, 99%. Et pour vaccin coronavirus là, lui-même c'est à 95%. Is it 95%?
Yeah.
Okay. I want to be right.
Sure.
I want to be sure on that. Okay. C'est 95%. OK, donc si 95%, ça veut dire
2 doses.
2 doses, vous pouvez prendre 2 doses, il vient ba ou protection 95%, selon tout ça et qui révélait département de santé Turks and Caicos et à travers le monde révélé. Donc là où il y a un peu de chance puisque s'il y a 95% immunité, donc ça est bon et c'est ça que fait le plus moun vin pour vaccin, vin plus moun vin sentir ou plus en sécurité pour capable et fonctionner dans le pays pour moun capable retourner sous normal, peut-être nous pas jamais retourner dans normal nous était avant, mais quand même, il capable meilleur pour moun capable travail, pour moun capable fonctionner puisque jusqu'à présent et moun pas à l'aise, même l'église pas capable bien fonctionner, moun pas capable ba moun accolade, moun pas capable même la paix, moun pas capable ba moun, donc nous pas supposé à vivre comme ça. Si pas gain rien, bon, nous pas gain rien nous capable faire, mais si gon effort qui capable faire, nous penser que les nécessaire pour tout le monde capable et bail contribution ou pour peut-être pas ou pour communauté et puis pour nous toutes. Merci beaucoup.
Okay, that was a lot. All right. What do you have to say about what Mr. Alcee said earlier in English? What's your response of Mr. Clare?
I'm touched by his intelligence, his deliverance, his experience.
Yeah.
I think he's really put the message across
Right.
in very simple terms that his people can understand. And he's genuine. I've known him for years. He knows what he's talking about.
Right.
And I know his people would listen to him. And so I want to applaud him for what he said. And I want to encourage the Haitian community. I mean, my business, a lot of my business is from the Haitian community.
Right, right.
So I will do all that I can, Ms. Robinson, to encourage everyone to take the vaccine and to take it serious and forget about the rumors that you're hearing around town. Don't let that get you down. Listen to the facts.
Yes, the facts, not the mirths. So, how do you think we can best get around the, I don't know if to call it discouragements or the misinformation, other than what we're doing right now? Like, we send out all these messages, we put stuff on the radio. How do we really reach the people so that they understand that they have to get the facts? Because a lot of persons right now, out of fear of what negative things that are not so spreading around concerning the vaccine, they have, pulled back and say, oh, I'm not going to take that. How do we reach those?
Well, I think there are a couple of things. I mean, the church is very important. And there are a number of churches here in Providenciales. I think we have to get into the community, the churches, the pastors, and not only the pastors, but I think someone from government, some person with authority. I mean, like you or one of the government ministers or the premier. Take time out, and visit one of the churches. Let her sit there. Let the people see her, and let the pastor pass on the information. Let her say something. The NGOs, the different NGOs here, the clubs, I think also they have a moral duty that they can help. And perhaps you could even, on the street, downtown here, have an evening where you have people there just like how you have us here.
Right.
And talk about it. As Pastor said, and my friend, information is important. And the correct information, that is what is needed. Right. I mean, we see, just look what's happening in America from what Mr. Trump did, the misinformation.
Right.
Okay? I mean, it's so serious.
Yeah.
So our people need to get the correct information from the right people. That's my advice to you.
Right. So, Candido, Mr. Moreno, how do you think we can reach the Spanish community, and what are really their fears and concerns? Are there things circulating, wrong information circulating within the Spanish community that would hinder them, stop them from wanting to take the vaccine? What has your ears on the ground heard about what's going on in the Spanish community?
Right now, the Dominican community know I get a vaccine because everybody was waiting for me.
Okay.
Right now, I go to go directly to them to say, I'm right here. I want you get the vaccine because the sample was me. I'm okay. I don't feel none. I want you do it too. That's why I go to be directly to the people.
Right.
I know we not can be do a meeting, but I know how I can reach by the people to tell them, hey, you have to do it. And then I know the 90% of the people go to listen to me because for many years, the Dominican community, when I speak with them, they immediately agree, because all the time I go to speak with them, all the time I trying to be with the truth.
Right.
The truth right now is I don't feel none. It's true, I don't feel none when I get the vaccine. I mean, I feel normal. That's a candido. I'm still doing to be candido.
Right.
And then I go to a plane to them directly to say, right here, even tonight, I go to trying to, I don't know what time is it right now, but if you had a chance, I go to pass for many places that they go to see me, that I'm okay.
Yeah.
And many people say, if you agree, and then I do it.
Right.
And then I agree to get the vaccine. I mean, many people right now in his mind is ready to get the vaccine.
Yeah. Because you led by example. So, what other do they have any other concerns other than how the vaccine might affect them, or do they feel like something else, like how Mr. Alcius was talking about trying to get rid of a certain ethnic group? So do they feel like somebody trying to get rid of a certain type of people? Is that one of their concerns too? If they take the vaccine, that either they're going to become sterile or they're going to die.
There are many people trying to make money. We are seeing like that. They make an announcement and prepare video. To turn the people, to turn the mind for the people.
Right.
Because the thing is, many immediately we born in, they put a vaccine to us. Many things for many things they use a vaccine.
Yeah.
If it's like the people thinking, we have a phone with GPS, we have many medication that we drink, and we drink medication for the flu, we drink medication for the headache.
We take the vaccine for the flu.
That mean they come, if it's like many people thinking, they can do it in that way too.
Yeah.
Because headache, who no get headache? And you immediately go and buy some tablet for this and drink it. You don't know if it have anything inside.
Right.
You don't know what they put inside. That means this one go to be the back thing. No, for that reason, I agree that the doctor trying to do something to stop the coronavirus.
Yeah.
And if it not stop the coronavirus, what they go to happen in the world? Everybody go to die.
Yeah.
And then we trying to stop this. How we can stop the coronavirus?
Yeah.
To using the vaccine, and that's it. After that, no more coronavirus. Yeah, that's my point. And that's what I go to explain the people and the road, the people in his house, the people for using my phone. I go to send the information. I go to show them my card I have in my pocket that I received the vaccine, and nothing happened with me.
So tell me, how do you think we can reach your community?
Right now, and with the church, because I have a group of pastor for the church. I have a group for the bar. I have a group for many things, and then to all the people I can reach in that way.
Okay.
Sometimes I make a meeting with all the Dominican community church in Spanish. We together many times, and we make a meeting with the people have the bar. I make a meeting too with all the owner. I mean, I can do it that way too.
Right.
I can go in the bar right now. Do they have a high music and things like that? Say, give me a 5 minutes, put the music off. Let me explain to the people like that. I can be like that, and the people obey me in that way.
Okay. So, is that only for Providenciales, or is that for the different islands as well? Or do we need to make some other connection for the other islands?
You know, right now, we're trying to be, you're speaking about the island, there's a Turks and Caicos.
Right, Turks and Caicos.
Yeah, I have a people in all the island over here. Yeah, we have a group. And all the island have a Dominican people. I have contact with one. Any situation that happen in this one or this one coming to me. And then any information I have, I send it to them too.
Yes, you send it to them, and then they have a group on that island that they can disperse the
Yeah,
information
Grand
to.
Tour, North Caicos, South Caicos, Sorky, all the places. I have a people, that I can send them all the information.
Okay.
Yeah.
Okay. So,
Yes, Mrs. Robinson. If I recall one of the statements the governor made, it is very significant. I tried to paraphrase him,
okay.
where he demonstrates the interest of the Turks and Caicos Islands people to demonstrate, to show themselves, to demonstrate that there are needs for the vaccine here in the Turks and Caicos Islands. To me, I believe that we are so fortunate, or we are so blessed. We are a blessed country, of course we know that, to be among, if not the first, or among the first
Among the first, yeah.
Caribbean countries that receive the vaccine. But it is an opportunity if we don't embrace it. We let it go. Who knows tomorrow if the situation is not going to be worse?
Exactly.
And then we let go the opportunity. We don't have the vaccine, and now situations become worse. Now we are in trouble.
Yeah.
So we need to capture this opportunity. Don't let it go. And how we can capture it is by demonstrating interest for the vaccine. Because it seems like if we neglect it, if we don't show any interest, then it will go away or will not be. Let's picture that. How many people are we? Our population is 40,000.
For that, yeah.
About 40,000. I invoked earlier on herd immunity. Imagine 40,000 people. Should we embrace the vaccine, then we will be on the very safe side of the spectrum. But if not, so it becomes easier for us because of the size of our population, 40,000. And then when I can see that there are people or authority who are willing to offer to us what we need or what we want. So now, if we decide that, well, we're going to embrace this, we're not going to let it go, well, for now, if we have vaccine for 4,000 people, I don't know. You know better than I do. But just throw out ideas.
So this first one, yeah.
Okay, all right, 4,000 people.
5,000.
Okay.
4,005.
4 to 5,000.
Yeah,
So if 4 to 5,000 people are vaccinated, and it is the clear message that we send that to whoever concerned that we embrace the idea. So now we need more. Then
We can.
exactly.
More will come, yeah.
Exactly. Then we will have more. Okay? That way, I think we can be in the very, very safe side of the spectrum. So this is a way to say that, again, let's embrace this opportunity. Let's capture it because it will be for our own benefit.
True. So you didn't get to see her sing in Spanish, but that's okay. Mr. Clare. So are you gonna agree with Mr. Alcius here about embracing and being on the right side of the spectrum where we are able to accomplish the mission?
Yeah, I've listened very carefully to both of what they've said.
Yeah.
And I think they struck the nail right on the head. There's no question about it. I mean, we're going through real trying times. And we have an opportunity to change our lives and to change the people around us. And so we need to take the bull by its horns. We need not to let our guards down, but to embrace the vaccine and encourage others to take it.
Yeah. Yeah. So, having said that, when you take the vaccine, as you are here now, we are all masked up and saying, we know that, okay, we still have to wear the mask.
Yes.
And that is something that we need to reach out to the public and let them know as well that you're still required to wear the mask, you know. But importantly at this time, we also need to let persons know that there are 2 doses.
Yes.
So when is your next appointment?
My next appointment is the 31st of this month.
31st or the 1st? The 1st.
31st of this is January.
Yeah,
the end of January.
The end of
31st.
January?
It has been changed to the 1st
to
of
the
February.
1st.
Oh, okay.
Yeah.
Fine.
The 1st. Yeah.
All right, good.
So everybody in here going to go back for the second dose on the 1st of February.
Okay.
But tell me though, while you are waiting for your for that 15-minute period that you have to wait after you take the vaccine, what was going through your minds?
Well,
What was going through your mind? Yeah.
I was not really worried. I thought from would I feel a bit giddiness, as we say, you know, or would my arm pain me or something? And I took the thoughts out of, you know, I erased that from my memory, and I was just watching other folks as they go in and come out. You know, I didn't want to think about that again because, you know, you start thinking negative thoughts. You know, I could I had to drive home. You know, so no, it didn't really. I had no negative thoughts after that.
Okay. Well, what about you? What was going through your mind while you was waiting for your 15 minutes?
Well, to me, 3 things. First of all, it is a normal vaccine as other vaccine. Secondly, I remember I said that I am a man of faith.
Yes.
To me, this vaccine has the potential to protect me, even cure. This is faith. I'm speaking faith now.
Speaking faith, yeah.
So I was very comfortable. Yes.
But, you know, having said that you're a man of faith, you know, there are persons who feel that, oh, I don't need to take the vaccine because they are a man or woman of faith. What do you have to say to that?
This is... Oh, go ahead. Go. I respect you, Mr. Clare. Go ahead in this, please.
God in his wisdom was able to walk through the minds and the hands of the doctors and the scientists to produce this. So I don't think we should question that. I think, as pastors say, I mean, faith, we go through that. I mean, you don't know what tomorrow holds, but you hope to see tomorrow.
Yes. Well said.
Well said, Mr. Clare. But to add to this, and this is one of the reasons why, in the beginning, I evoked the question of religion and ethnic.
Right.
Now,
Go ahead.
it is a wide subject
Uh-huh.
to discuss. Maybe will take me another time
Uh-huh.
to discuss that. But for now, what I can say, I know faith works. And that's why we have a problem in psychology when an experiment when we are to test a drug. Because what psychologists will do is to have a control group and experimental group.
Right, right.
Now, the control group sometime, if it's with human, then we will use placebo. Now, the problem now with placebo is not supposed to work.
Right.
It's not supposed to work because it is a placebo, like a sugar pill.
Yeah.
But what we found out over time, and this research from Harvard University, they found out that sometime, because of faith, a placebo would work.
Yes.
A placebo will work because of faith. Because in your mind, you believe that it will work. So even though it is a placebo now, your mind will help the placebo to heal you. So with this, it will take more time. And this is where another question comes. Why is it taking so long to have a vaccine? And I think this is one of the factors that create doubts in people's mind, because we know that it's supposed to be like between 9 years to have a vaccine available. Why is it that COVID-19 vaccine comes so fast? Okay. Technology has changed over time.
Yes, it has.
Okay.
Just look at your cell phone.
Exactly.
Can you even remember the first cell phone?
Oh,
How
was
it looked?
like a radio, like a big portable radio. Okay, so now this is where people need to be aware of the reality. So, yes, faith works. However, God recognizes the importance or the use of medicine. So I cannot just with one word tell people, well, if you have faith, you should not take the vaccine or not. But I can leave that to them to reflect on that. Okay? Reflect about the will of God.
Right.
And then if you are really a person of faith, then the same God you believe in will give you the answer. Yes.
Okay, all right. Well, I'm telling you, we are at the end, but I'm going to give Mr. Marino his opportunity to say, to respond? You've listened to both of them now. What is your response in a few words? Because we're gonna have to wrap up in a minute.
Okay, he carried out a good explanation for many things. Because the thing is, right now we have the coronavirus. We have to be thinking about the coronavirus right now, not for the future. Not the thing go to happen after. I need my life right now. That means I have to get the vaccine to cut the coronavirus not go in my body. After another thing I can bring in my mind, I keep it and stop, until the coronavirus not come in my body. Because, that many people can see, but who create the doctor? God. And then nobody can get, as in, if I have a big problem in my heart and things like that, I go to do myself. God create the people to do this job because He can do everything. He create a doctor, create a scientific, create an engineer, create a lot of people together to make the world. That's simple. The scientific create the vaccine for the coronavirus. That's why we have to agree to get the vaccine, control the pandemic, and then we can be continuing forward.
Yes.
And that's my point.
Okay, seeing that you are right there, I want you to give your final words in Spanish to the Spanish community.
Yo le puedo decir a todos los dominicanos que ahora mismo ya los médicos crearon una vacuna para que nos podamos salir de este problema que es el coronavirus. Sabemos que la vacuna fue creada por médicos, entonces tenemos que aceptar vacunarnos para que el coronavirus desaparezca. Vamos todos a aceptar vacunarnos porque la vacuna que fabricaron ahora mismo es como cualquier medicamento. Medicamentos que te pueden quitar un dolor de cabeza, medicamentos que te pueden quitar una fiebre, medicamentos que te pueden sanar una gripe. La medicina que hicieron ahora mismo para el coronavirus es para matar ese virus que nos puede introducir en nuestro cuerpo y nos puede matar. Vamos a seguir con vida. Y usamos nuestra inyección, nos ponemos nuestra vacuna y continuaremos en este mundo.
Okay. All right, Mr. Alcides, your final words to the Creole community.
Bon. Dernière parole nous à tout le monde qui parle créole. Faut que nous disions c'était un immense plaisir pour nous être capables avec vous assoya ou quel que soit l'heure où attendez chose ça pour nous être capables parler concernant sujet ça qui est très crucial dans temps ça, parler de coronavirus et qui meilleure façon nous capables et joindre liberté nous même quand pas dans toute intégralité mais dans une façon pour nous capables fonctionner et nous parler de questions de vaccine qui c'est une opportunité que gouvernement offrait à tout le monde puisque nous gagnons en pile chance nous parmi et nation Caraïbes qui en premier gagne vaccin et yon nan bagay gouverneur a te dit yon nan déclaration il te fait il te dit que bon et si pas gen moun qui montrait intérêt pour vaccin c'est comme si t'a semblé que yo pas gen intérêt pour yo voyer pour nous encore c'est que ça pas une bonne chose pour nous parce que demain nous pas connaît qui ça va le porter eh bien nous demander pour tout le monde capable réfléchir bien, chercher conseil, parler avec médecin ou et puis gagner équipe et dans le département santé dans Turks and Caicos Islands qui pourra faire plus sensibilisation tout et puis éducation pour yo et parce que nous connaissons des questions qu'on a aimé poser. C'est pas que ou pas vrai pour un vaccin, mais des questions ou t'as aimé poser et d'accord avec vous. Faut que questions ça yo répondre. Eh bien nous espérer dans les jours qui viennent donc pour aller gagner et campagne d'éducation ça et ça pourrait permettre que nous toutes nous à l'aise pour nous connaître plus de vaccins ça et pour nous connaître qui position que nous capables de gagner par rapport à vaccin. Gagner un pile bagaille encore mais dans l'autre édition lorsque vous invitez nous va gagner chance pour nous capables partager plus avec vous. Moi dire merci pour attention.
Okay, great. Your final words, Mr. Clare?
Well, I think we've covered all the ground that we should have covered for the evening.
Yes.
And I just want to reiterate the fact that we should not let our guards down. Mm-hmm. We must continue to follow the protocols, to wear our masks, to wash our hands, to keep our social distances, and remember that we have a golden opportunity to save ourselves and to save those around us. God bless us.
Okay, great. Thank you. And we would like to thank Radio Turks and Caicos. We also would like to thank you, our listening audience. And, of course, we cannot have done this without our guests. So, thanks to you. And we'll see you again next week for another edition of Your Health Matters.